Now, Dr. Derman, I really wanted to ask you this question. A couple months ago, I asked my primary care doctor what they do for patients with low back pain. And she said they quickly refer them to a specialist because they can't prescribe strong medications. Given that primary care doctors should follow clinical guidelines, what is your view on this?
Well, the clinical guidelines say that strong medication should not be prescribed. So everything suggests that for chronic low back pain, which means back pain that's been present for 3 or more months, narcotics or other type of strong medications are not the answer. And in fact, spine surgery is almost never the answer for those patients either. It's really about finding a good constellation of non-surgical things that can help them with their back pain, which is usually a combination of physical therapy and other therapeutic type exercise. Sometimes chiropractic can fit into that mix. Non-narcotic type medications, such as anti-inflammatory type medications, if there's no medical reason that they can't take them. Exercise, weight loss, avoiding things like smoking, which we know is bad for your spine and can cause pain. And then in some instances, injection-based modalities can be helpful as well.
I've got the clinical practice guidelines for treatment of patients with acute low back pain. The guidelines recommend reassurance on the favorable prognosis and advice on returning to normal activities, reducing or avoiding bed rest.
Yeah, that's important. That's important. So bed rest used to be prescribed. And now I never tell people to have bed rest. That creates all kinds of additional issues. I mean, in the acute phase, when people throw out their back, frequently they can't move. So we can't expect them to go for a run. But once they start to feel a little bit better, the more motion they can tolerate, the better. And very rarely, even though it can be painful, does that activity cause additional problems.
And of course, the use of non-steroidal anti-inflammatory, as you mentioned.
When I see those patients, I give them reassurance. We give them an anti-inflammatory and we send them to physical therapy because that's usually all they need. And even though these episodes of pain can sometimes, especially acute low back pain, can be very severe, and they think oh my gosh, something is horribly wrong. I need an operation or something like that. The amount of pain they're experiencing is not necessarily a marker of the severity of the problem. And almost always within a couple of days to a couple of weeks, their pain subsides and they go back to being who they are. And getting them back to movement is probably the best way of preventing future episodes from occurring.